And welcome back. Well, I think many of you might have some mild hearing loss as we age. That seems to happen to everyone. And we have someone on that can help you out with that. This, Dr. Jack Shohet, Shohet Ear Associates. Did I pronounce your last name right?
That's great.
All right,
yes.
Very good. And, I don't know, a while back, my stepdaughter had an app on her iPad. And what it would do was create tones. And next to the tones, it would estimate your age. And sure enough, it worked. The time she did it, she was like 19, 20 years old, and she could hear all of them. My little girl could hear them all. And then as she went up those tones, each one of us, my in-laws down to my wife, and we're all different kind of like age groups, we could each hear less and less, and it fit the pattern perfectly. So even if you have pretty good hearing, there are certain tonal ranges we begin to lose, correct?
That is correct, yes. As we get older, we typically start losing the high frequencies first, and then it starts bleeding into the lower frequencies as we get even older.
Right, and it seems to follow just like your eyesight. You know, you hit that 40 years old, it's time for the reading glasses, I think. Well, a lot of people, I think that, they may have some hearing loss and may even have loved ones that are telling them, no, you're asking us a lot of the times what we just said to you. They are reluctant to seek out the options that are out there for them. And I think many a times they may think of those old style hearing aids. And they're just, that's not the case anymore, is it?
It really isn't. There's a lot of denial in people starting to want to wear hearing instruments. But I think I've seen a trend towards people being more accepting of the devices. Probably the best thing to come along for hearing instruments has been the Bluetooth headsets.
Right, yeah.
People have gotten used to seeing other people wearing something over their ear. So
exactly.
Wearing a hearing aid almost looks like a newfangled kind of Bluetooth headset.
And when someone comes in and you begin to evaluate them, do you use the kind of test that we all kind of grew up using? You put them in a soundproof booth and you start with the tonal ranges and things like that?
Yes, that is still a very important part of the whole process of wearing hearing instruments, is to get a good gauge of where your hearing is. And we do that in a soundproof booth with pretty sophisticated equipment and trained audiologists that test a patient's hearing and get a good sense for what they're able to hear and what we need to help them out with.
Is hearing loss inevitable? And to some degree, at least?
To some degree, yes. About a third of people over 65 have a significant hearing loss requiring some type of amplification. Half of those over 75, and it's significantly even more, over 85, have a significant amount of hearing loss that requires some type of help.
Let's talk about the different technologies that are out there now. There are, of course, the very small devices that you could put over your ear. There's even different types of implants that are available now, right?
That's correct. So most people are familiar with the traditional, conventional hearing instruments that go behind the ear. There's some that go inside the ear canal. There are extended wear devices now that you can place in the ear canal. They're relatively invisible, and they can be worn for several months at a time. And now there are implantable hearing devices, surgically implanted devices, one of which is completely invisible, and it sits underneath your skin for between 4 and 9 years. So there's nothing you have to do for 4 to 9 years. You can turn it on and leave it on for that whole amount of time. You can, it comes with a remote control that allows you to toggle between volume settings and different types of environmental settings, or you can just leave it alone. You can swim with it, you can exercise with it, you can sleep with it. And one of the nice things, I think, about this device is for those people that have dexterity issues and have a difficult time either changing their battery or putting their hearing aid on or off, which believe me, it happens, this is a great option for those people. It gives them an amount of independence that they didn't have with their hearing aid.
What are the different levels of these hearing devices? Somebody who would need maybe an implant, would they have a bit more hearing loss than someone who has a certain tonal range where they have I think there's types of hearing aids that really help when you're in a crowd to focus on certain sounds, right?
Yeah, there are different technologies that are built into hearing instruments today. They're very sophisticated. A hearing aid is really a microcomputer. It's got a little microchip, just like a computer does. And it allows it to select between different microphones that are set in different directions and allows it to collect sound from different areas depending on what type of environment you're in. And the sophisticated hearing aids, they actually sense the type of environment you're in, they sense the background noise you're in, and they're able to select the appropriate microphone setting to allow you to collect what you need to collect.
Wow. Yeah, that's amazing.
Pretty high tech nowadays.
And are some of them, I know you mentioned the Bluetooth devices obviously for cell phones, but these are also Bluetooth capable in some instances?
Correct. A lot of hearing instruments nowadays are Bluetooth enabled so that you can communicate with your phone, that you can communicate through your car to your phone.
Oh, wow.
You can hook up to your TV at home. So there are a lot of Bluetooth technologies that allow you to take advantage of those things that are inherent to Bluetooth. But there's also a lot of older technologies like loop technologies that have been around for a long time that are being utilized more and more in settings such as churches or places of worship, movie theaters, that take advantage of older technologies such as a telecoil. So there's an appropriate place for each one of those different types of technologies.
Okay, so what you do is someone comes in and obviously you test them the range of hearing loss they have, and then you talk to them about the different devices that are available to them.
That's correct. You know, we really try to get a sense of what the individual person is looking for and needs, and what types of environments that they're in most of the time, and what kind of demands there are in their hearing, and what types of things they're looking for in terms of cosmesis. And we try to make a good recommendation based on all those things. You know, we dispense hearing instruments, but we also do implants. We do middle ear implants for people that have moderate to severe hearing loss. We do cochlear implants for people that are completely deaf. So we're able to find the right instrument for each individual.
What about the two different ears? Is it generally bilateral as far as your hearing loss goes, or can one be more severe than the other, just like testing for your eyesight?
It's a great question. Generally, as we age, we lose our hearing in both ears at the same time to the same degree. So there should not be a significant degree of asymmetry between the two ears. And when there is, it's important to try to find out what's going on there.
Because there could be more than
There could be more than just the age-related type of hearing loss.
Okay, and I imagine that people who have worked in certain environments over the years may have more severe hearing loss, correct?
Noise plays a tremendous impact on how much we're losing nowadays. And in fact, recent studies have shown that because of the loud noise in our environment today, people at even younger ages are starting to be impacted by hearing loss.
Yeah, I've seen that out there. And what about caring for your ears? And I know that may seem a very basic question, but over the years, people have used different devices to clean out their ears, Q-tips and things like that. And there's the ear wash things that are, I guess they're still on the market. What is something that you should do on a regular basis, just like caring for your eyes or anything else?
Well, you're right. You don't do that much for your eyes. You pretty much wake
Maybe
up,
drops
you
once in a
wash them
while.
off, and so on. With your ears, they are self-cleaning. Okay, so whatever needs to come out typically comes out. And I tell patients, you know, wax is not a bad thing. Wax is actually there for a reason and has antibacterial properties. It kills fungus also, and the oil content of wax actually wards off moisture. So wax is not a bad thing, and having some wax in your ear canals is not a bad thing. And your body will take care of the wax that it doesn't need in most cases. Your ear canals are also pretty well pH balance in order to prevent infections. And when you start messing around with it by putting drops or solutions, you can cause more problems than do good.
We have a lot of swimmers in this community. Is
Yes,
it
we do.
advised to wear earplugs if you're obviously a swimmer that is going underwater a lot, doing some diving, that sort of thing?
No. Typically, if you're going to be in the pools that are chlorinated, I typically don't recommend, unless you've had problems in the past with your ears, I don't recommend wearing any earplugs. In the ocean, it's a different story. If you're a surfer, and I take care of a lot of surfers with surfer's ear, if you're a surfer, it's a good idea to wear earplugs, but for a different reason. Surfers tend to get this growth of bone in their ear canal called exostosis of the ear canal. They're bony growths, benign bony growths in the ear canal. And you can slow down the growth of these benign growths by using earplugs. So I recommend earplugs for surfers, not so much for swimmers in a pool.
Okay, is that due to the salt water or the bacteria that's in the ocean
Well,
water?
again, for the surfer's ear,
Yeah.
to try to prevent the surfer's ear if they're a surfer. If they're swimming in the ocean regularly, unless they've had problems in the past with ear infections, I think it's okay not to wear earplugs.
All right, and if someone wants to get a hold of you, your number is 949-631-4327, or here, 631 here, and your website is eardoctor.org. And where are you located?
I'm in Newport Beach. We have an office in Newport Beach, and we just opened an office in Seal Beach. So we're having a grand opening actually next week on the 5th. At 5:30 there, and the public is certainly welcome.
All right, Dr. Shohet, nice meeting you. Great
Thank you,
advice, and nice to get all this information. Just even the simple information of how to care for your ears is important.
Great.
All right,
Thank you,
we'll be
Ken.
back in just a moment. Okay.